Doctors, moving on to a very simple topic called as cardiac output calculation. Recently the measurement of cardiac output has been absolutely or getting done with echocardiography, Doppler echocardiography, but still old school physiology question papers still do emphasize on Fick's principle and Stewart Hamilton principle, right? Though it has not been commonly done, since it's been repeatedly asked over few years, it's better if we know what is what. Okay, so cardiac output calculation is done by according to the old school thoughts. Let us start with Fick's principle. So I suggest not to break your head in order to trying to understand Fick's principles and all. It's just pointers. Just get to know the formula, substitute all the values, get the result, get a PG seat, keep moving forward. Okay, so there is no point in revisiting history and ancient techniques. So Fick's principle is essential to measure. It's been done to estimate cardiac output. So cardiac output is calculated using rate of oxygen consumption. Rate of oxygen consumption divided by arteriovenous oxygen difference, which means arterial oxygen content minus venous oxygen content. This is Fick's principle, doctor. Number 2 is thermodilution method or other dilution methods, or these are all coming under a common cluster called as dye dilution method. Dye dilution method is based on a principle called as Stewart-Hamilton principle, dye dilution method, doctors, where you have the same kind of logic, amount of dye injected in the body divided by arteriovenous dye concentration, that is dye dilution method. In thermodilution method, right, we use a special dye that is nothing but cold saline. Instead of dye, if you use cold saline, we call this as thermodilution method. But the novel techniques includes measurement of cardiac output by Doppler echocardiography, doctors. Just a very small topic. Be familiar with the formula. I just want you to know this. That's it. Be familiar with the formula. Fick's principle. Right? Rate of oxygen consumption divided by arteriovenous oxygen difference. That's it, doctors.